Hey y'all, I hope you're well. Welcome to another episode of Healthcare Boulevard. This is a podcast where we shine more light on healthcare, and our goal here is to provide more options to people looking to choose healthcare as a career path, regardless of their background. My name is Sena Kapomo, and I am your host and creator here. I thank you for tuning in. I appreciate your support. Remember, you can tune in wherever you get your podcast. Without further ado, let's get into today's episode. Let me jump into the interview. I am here today with Dr. Johnson, who is a pharmacist and actually was my teacher in pharmacology when I was in PA school. Dr. Johnson, welcome.
Hi, nice to be here. So good to see you again.
Likewise. I haven't seen her in like over a year now, and I have so many alarms I can't keep up. But how are you doing lately? How is being a pharmacist in COVID? First of all, let me start like that.
So I'm actually new to practicing as a pharmacist more recently because, as you know, I was teaching mostly at University of Laverne. And so when COVID first hit, I actually was the only thing I was doing was teaching at that time. However, since earlier this year, I started to work as a pharmacist again for a medication management company. So we get different contracts, and the essential thing of it is we provide tailored medication recommendations to providers, and also we speak to patients and we help patients kind of navigate their way through healthcare. So it's all been telephonic and not face to face, or not through other platforms, mostly through the telephone. So that's been really good. So I couldn't speak to sort of some of the traditional. I'm sort of in a non-traditional pharmacist role at the current time.
Mm-hmm. And that fits perfectly because I do like to highlight those not so traditional paths that different professions take, just because it's not necessarily the only way that there is in living and practicing that specialty. So what got you into pharmacy? Let's go all the way back to 5 years ago.
So you're really gonna make me go back. Yeah, 5 years, sure, great. So what got me into pharmacy? I think as a young person, I knew I wanted to go into healthcare. I think I was always interested in helping others, serving others. And so I think it was a natural sort of path for me all the way since, like, I would say middle school or high school. I wanted to go into healthcare. Mm-hmm. After going into starting my undergraduate degree, and started exploring different things, and I just wanted something that wouldn't take a lot of time in terms of investment in the profession, investment in different aspects of having to do, residency, along with continuing more, like extended PGY1, PGY2, PG, like in medical school, sometimes they go up to like 6-7 years to become, for certain professions like dermatology. So because of that, I decided that pharmacy was a little bit shorter. And although there are pharmacy residencies, but usually they cap out at about 2 years. So I said, well, this seems like a different path that I can still serve others. I don't have to be, spending my entire youth in and educating myself and having to go through, the education system, and something that I could get to practicing a little bit sooner. So that's why I chose this profession. Chose really essentially now I'm actually have sort of transitioned. So I would say that even within the field, that's part of also why I chose it, because I realized that there's different aspects. There's pharmaceutical industry. There's what I'm doing now, which is like medication management side of things. there's clinical pharmacists that are practicing in ambulatory care environments like clinics and other, hospital pharmacists. We have community pharmacists practicing in a lot of your traditional, that's the sort of traditional retail role that most folks are familiar with. When they think of their pharmacists, they think of the community pharmacist that is dispensing out their medications. But there's so many different aspects, including academia. And I'm actually in a sort of niche field of academia, I think, in that I'm teaching other healthcare professionals and not necessarily teaching pharmacy students that are obtaining their PharmD degree. So it's even another sort of niche within a niche. So that's part of why I chose pharmacy. Part of it was I wanted something that I could get my degree quickly. And then secondly, that I would have options. So if I decided, I want to do something else along the way, then I had those options and I could, sort of switch paths and go maybe do like what I'm doing now in academia. And then, going towards, medication management side. There's health plans, even the health plans, they hire different folks to kind of narrow down and look at. And one of the things that we do now, that I do now is really with the company that I'm with is really just looking for ways that we can help the patients, minimizing costs. And sometimes we can see things like where patients need to be sent for a referral. How many ED visits have they had? How many ED visits or maybe hospitalizations? We can reduce costs in those ways, or maybe we can synchronize their medications so that they're maybe not taking so many. Maybe they have 3 antihypertensives and we can use a combination tablet, or maybe we can consolidate dosages and things like that. So we look at the medications, look for ways to save money for really overall for the patient and try to improve the outcomes for the patient. But looking at it sort of from the critical eye of the drug standpoint and what things we can do with the drugs, and really trying to meet the patient's needs and then also meet the needs of the providers, that the other part of the rest of the care team. So.
Right. And for you, did you get a bachelor's degree while you were undergrad? And if so, in what?
Yes, I did. So usually the traditional pathway for PharmDs is to do a bachelor's degree first. And then my bachelor's degree was in biological science, which is sort of, I would call that like the liberal arts of the biological, like sort of biology, because you can kind of pick and choose the classes. So I took a lot of actually anthropology and a lot of biology classes, and some psychiatric sort of back then they used to call it like neurobiology or psychobio classes that merged sort of with anthropology and looking at different things like that. So
okay.
That's
And when you went to school, did you end up doing any residency, or did you do the traditional way and stop after your 4 years?
So I did. I think I would say now more and more it's becoming traditional for pharmacists to do a residency. I, however, was sort of at the point when I finished my degree, I was like, I want to just start practicing. So that's what I did. I didn't pursue a residency and just went straight into practicing, and then sort of got a taste of teaching. And then that's when I started like going into teaching and teaching in the clinical setting first, and then more in the didactic setting, as what you know me from.
Right,
so.
Right. And how many years did you practice clinically after graduation before you started teaching? And what setting were you practicing in?
I want to say, I don't know the exact number of years. You're really like making me like pull back time. So I would say
today.
it probably was about 5 years of practice, maybe 5 or 6. But by the time I started teaching your class, that was probably about 6 years into me practicing professional, like clinically. And from graduation until I started teaching in the didactic years, I started doing like having students come up for clinical rotations probably after about 3 to 4 years. So there's a difference in time frame, and it just depends on when I was practicing, we had students come in, at our site, and then later I started teaching, formally for didactics in at the university.
And were you practicing as a I'm trying to remember, I think it's general pharmacist, like the ones in CVS, not general.
So we have so we do actually, it's okay. We have actually for pharmacists, we actually do have different board certifications. So I think at the time when I first started teaching, I was a board certified geriatric pharmacist. So I was dealing quite a lot with I think just as the nature of sort of the patients that I tended to come and have encounters with, they were geriatric patients. And then I think during the course of the time from when I started teaching, somewhere in between there, I also got board certified for ambulatory care. So those are kind of the two areas that I have the most experience.
So when you say you were certified for geriatric and then ambulatory, is that like you're learning the material and going and taking a test, or is it going back for additional education? How long do those certifications take?
Yeah, you have to you do have to get some additional education, and also you have to have there's like, I'm sure it's a little bit different now, but you have to have so much time working within that particular field, or working with that patient population before you can get that certification. So you have to have the time first, and then there is of course an exam that you have to sit and take as well.
Okay.
And or there's other routes. It depends. It actually, sorry, let me go back, because it does depend on the actual certification that a person has. So there's some of them, sometimes persons will get it after completing their residency. So they'll go through everything during their residency, and then sit for the exam after they do residency. The way I did it, because I didn't do a residency, you actually have to have more time, or more number of years that you've been practicing before you can get the certifications with the patient population.
Okay. And as far as your transition from clinical to education, how was that? Was that intentional?
It was actually intentional, but it was sort of intentionally unintentional, if that makes sense, because I had been practicing and bringing on students into the site where I was working at the time. And then I was really pushing. I ended up actually transitioning from one employer to another. And then during that time, the new employer that I went to, I was trying to get the site going and try to get students to come in. And some notable colleagues that noticed, like, hey, this is what you're into, like, oh, you want to teach. So that's how I ended up, someone sort of referred me to the teaching program. And it was like, I had been applying to other positions at other institutions. And then it just happened to like fall in my lap at the right, like the exact moment when I was already like sort of going down that path. And then here comes along like something that actually like suited like exactly what I needed. So, or what I wanted to do at the time. So.
Right. And did you find your clinical experience was helpful in your role as an educator?
Oh, of course. I think that's probably the biggest, one of the biggest things that, I think anyone can, when you finish your degree, I would say you have a lot of knowledge. And so you have the knowledge under your belt, but I think sometimes providing real world examples to students, I think that's what really makes the material come to life. And that's what really helps students to understand. And the more different experiences that a person has, I think sometimes they're able to bring some of those experiences into the classroom and sort of make cases of patients and so that students can really understand. So I definitely would say that it definitely helps me quite a bit. But I'm teaching sort of across different health professions. So it's a little bit different because I think that if I were specifically teaching like only one health profession, then it may be a little bit different. But because I've taught not only for your class, which was the PA students, or at the time, future PAs, now physician assistants, and also for some other programs, some other programs like athletic training students, and also now I'm teaching for students that are planning to their master's. It's a master's program, but many of them plan to sort of do what you're talking about now in this podcast, and that's to look for different opportunities within healthcare that sometimes may require, an additional degree. So it's a master's in community medicine that I'm one of the classes that I'm teaching for right now.
And now with your position online, clearly a lot of things have gotten online and that transition online, because of COVID and so forth. Was that a factor in that role sort of blooming? Because you're not the only pharmacist I've spoken to who are either doing something online in terms of career-wise, being a pharmacist online, or either full-time or part-time, or they know about it. So it seems, at least, for somebody who's not in the pharmacist world, it seems like it's a it may have been there, but it's a little bit more prevalent now, that area is booming more. Do you think that's the case, or am I just tripping?
No, I don't think it's the case. Actually, I don't think you're tripping. It may be just because more people are familiar with sort of remote work now because of COVID, but I don't think that it is something new. I think that there's an increased demand perhaps now because of COVID, but I don't think that. I know that before I took on this role, actually before this role, actually, when I first started practicing, my very first job that I got right out of pharmacy school, the role that I was going to transition to right after that was sort of similar to what I'm doing now, which was sort of looking at overarching themes to try to help improve outcomes for patients. But it was in a corporate setting. During that time, actually, I was recommended by my supervisor to apply for a role that was sort of in the same realm of things, but I actually didn't take the role. I actually ended up doing something else because I wanted to do something a little bit different, more like directly with patients, but it was very similar to the one I have now. So I would say that there are a lot of opportunities out there. Sometimes it's harder for junior pharmacists to get those roles. So it's not something that most people would get straight out of, finishing their degree, getting licensed, taking their NAPLEX exam, which is the North American national exam that has to be taken, and then you have state exams that you have to take as well if you want to be licensed in different states. And so most folks, once they graduate, they don't actually, these roles are not as readily available. Some of the traditional pharmacists in community pharmacy, those are probably the most highest demand positions. But I would say that definitely these sort of remote, or I don't even want to say remote, but non-traditional pharmacy roles, there's a lot of them out there. It's just not as widely known. I think for people that are outside of the pharmacy microsphere, I guess that's the right word to use. So I think because you're sort of out of that microsphere, you may not be as familiar. But yes, they're there, and there's probably a more demand now. I would say, but they've been there for quite some years.
So you are still collaborating with other professionals, just like you would do in a traditional pharmacist setting. I'm imagining talking to the patient's physicians, talking to whoever them, and so forth.
we do talk to physicians. We talk to sometimes physicians. We talk to sometimes we have to call the pharmacy and find out information about. I can give you an example. Sometimes there's some things that we will see in a patient's medication profile or what the patient tells us. I had an instance of this without like disclosing patient information. Right. I had an instance of this where a patient was he was taking his medication wrong, and he thought he was supposed to take I don't remember exactly the details, but he thought he was supposed to be taking half a tablet twice daily, and actually he was supposed to be taking a full tablet twice daily. And so he, this was something that I was able to identify in our virtual converse, or it was not virtual, but it's like telephonic conversation. I was able to identify this sort of discrepancy because I can see like how, and I can follow up with his pharmacy, like, and find out. And that's actually what I had to do. I had to follow up with his pharmacy and say, which prescriptions did he have, because he had so many different providers. And this is one thing I think that pharmacists are really good at, is identifying, okay, what is the most recent prescription? And then how are you supposed to be taking it now? And then, sometimes what happens with a lot of patients, and I've seen this even before practicing with the company that I'm with now. I've seen this before, where patients will still have an old bottle of a prescription or old vial of insulin, and they may continue to use it until the medication's gone, but it has an old instructions on there. So the instructions may be, take one tablet daily, and then they're supposed to be taking half tablet daily, but maybe they are taking half tablet daily, but the instructions say one tablet daily, but they're continuing to fill it the same way that they have been filling it before that. And so we have to get an updated prescription. So those are some things that we see. I think I would say that it's not just like me and this in the role that I have currently, but I would say that a lot of pharmacists sometimes catch things like that, where there may be a discrepancy, because especially if patients say their provider dies, or the provider moves away, and they're still in the same practice, but now they have a new provider that's overseeing their care. And sometimes those things don't always transition, or maybe there's a cardiologist that wants to put a beta blocker on board, but the patient already has a beta blocker that was put on board from the primary care physician. And so sometimes there'll be a duplication. There's two medications of the same class. And so those are some things that sometimes we can identify, oh, wait a minute, this is a duplication in therapy, or this is, something that, wait a minute, this patient was on a 10 milligram, now they're on a 20 milligram, and somehow, and a lot of times this happens when patients, what I was saying before, when they're transitioning from one place to another. So when they're, going into the hospital, and then maybe they get placed on whatever is on the formulary inside the hospital. And then when they go back out into their community pharmacy, their primary care provider might put them on something, but they may get a bridge prescription to extend them from their hospital stay. And sometimes that prescription could get perpetuated, and sometimes patients will get put on drugs that they never come off the patient list, and things like that. So those are some things that pharmacists have traditionally been able to identify and then make those corrections. And it's a little bit easier, I would say, from the standpoint of being in an office versus being in a pharmacy and having to call, because I used to do this also when I was working in a ambulatory retail setting, and patients are calling, you're giving flu shots, you're doing all of these different things, and then you're still trying to follow up on discrepancies, maybe say for a prescription or for a patient. Well, when you have the time to just focus on one thing, it's a little bit, sometimes it makes it a little bit more of an advantage, and a little bit easier to just focus on getting those corrections made. So that's where I sort of come in with our patients. So maybe I'm, working along with their pharmacist at the local pharmacy, and just I'm doing all the legwork, sort of like calling the pharmacy, asking them, so what was the last prescription? How did it look? Or what were the instructions? And then calling back the doctor and saying, hey, or sending a message over to the doctor, hey, can you please update this prescription? and then, closing the loop, and then calling the pharmacy and say, hey, we got the prescription, can you fill it? And then just closing the whole loop and making sure that the patient goes and picks it up, and sort of just doing everything all the way to the end. And I think that's the advantage of not necessarily being in the pharmacy.
Okay. Can you tell me a little bit about leadership as a pharmacist? What are some opportunities that present themselves as a pharmacist?
So there are a lot of leadership opportunities. So just like I think a lot of healthcare professions, we have, like within California, I'll start with the national level. We have there's American Pharmacists Association. We have the American Health, ASHP, American Society of Health Systems Pharmacists. So these are both national organizations. Several pharmacists I actually belong to both of those organizations, but those are just a couple. There's a lot more. There's associations for pharmacists who are independent owners. There's associations for folks in pharmaceutical industry. So there's lots of leadership opportunities for people to get involved. If they want to be involved legislatively, in terms of getting involved in some of the laws that get passed that surround healthcare. So there's different leadership opportunities, I would say. And trying to think of what else. There's a lot of things, like I have been called to be on different sort of like councils and bodies, even within sometimes like a community. So for example, in California, we have in the different counties, and then sometimes different folks at the county level or maybe at the state level, sometimes we'll have a task force that pharmacists can get involved with. So I know that, for example, with COVID in California, we had some of the folks, like I mentioned, we have California, I said we have the National American Pharmacists Association, but we also have the California Pharmacists Association, and we also have a California Society of Health Systems Pharmacists. And I know that both of those organizations were actually involved with the COVID-19 task force that was with the governor and with a lot of other health professionals. So those are just some areas. I know folks that are involved with American Society of Aging, and there's all sorts of different groups that outside of, I would say, even traditional pharmacy, or being involved with other groups outside of that, with American Diabetes Association, being involved in depending on what sort of things a person is interested in. There are lots of leadership roles out there. Right. It just depends on the person and what the level of involvement or the level of commitment that a person wants to commit to. And so for some folks, like, they're heavily involved in leadership, and then others, they're happy, just working and taking care of their families.
Yeah. Yes. And lastly, do you have any words of encouragement for future pharmacists who may be listening to this?
Words of encouragement for future pharmacists or future healthcare professionals, I would say, is just to look into the profession if it's something that you really think that you desire to do it, and speak to people and talk to people. You can listen to things like this, or actually talking to people if you know anyone, or try to go to networking events where you can meet some people, or even all the schools of pharmacy. I know they all have information sessions, and so when people are pre-pharmacy and wanting to get into pharmacy school, there's always usually student organizations that sometimes will have things, and they'll, not even just student organizations, but the universities will put on things for students to really learn about the different programs, learn about what the profession is about, and sort of all the other aspects of pharmacy. I think I didn't really touch on any of the other aspects of pharmacy and what we've talked about today, but I would say that there are so many different things that, getting that doctorate of pharmacy, that PharmD degree, not everyone even goes and gets a license. So I have colleagues that don't even have licenses as pharmacists, but they got the degree and they're still practicing and still doing things, but just without a license, not practicing as pharmacists, obviously, but they have that degree, and then they're able to use that degree to further advance into pharmaceutical industry or different other aspects. But so it's not always necessary to in fact, I knew someone when I was a student who knew that he was not going to get his license when he graduated. And so, there's some folks that they don't even take the test because they know that they won't practice as pharmacists, right. But still getting that degree to pursue other aspects of it. So I would say that there's lots of opportunities, and there's other things like this platform and other platforms where you can learn more about the profession and really find out if it's something that you want to do. So.
Well, that's all I have for you. If you don't have anything else to add, I thank you for joining. I know it's Friday evening, and I'm sure you have a party to go to. I'm kidding. But I'm going to go ahead and end this here. Thank you so much for joining, Dr. Johnson.
You're welcome.
You have a nice weekend.
Okay.
All right. That's all I have for you today. Thank you again for joining me. I appreciate you. Please subscribe, follow, like, comment, and share. And stay blessed. Bye.